So the next question then is, do Master Herbalists work with other therapists, and do we refer patients for counselling or to psychotherapists and sometimes to medical doctors? What other kind of therapies do we work with?
So as a Master Herbalist, we all have our own other therapies that inform Master Herbalism. So
you're a colonic
I'm a colonic therapist.
Yeah.
I was trained as a nurse. So my clientele would primarily have physical needs or physical imbalances, specifically looking at the digestive system, constipation, food sensitivities, and digestive-related degenerative problems like cholesterol, liver, disease, kidney issues. So that would be, I suppose, my area.
Yeah, that's what you...
So by us all simply being Master Herbalists, normally even to be on the course, we have had immersion already in the healing arts in some form. My process of assessment of each client will really dictate what supporting other therapies I might recommend.
Yeah.
So my assessment form, just by simply completing it, because my assessment way is very physical, I have to look at all aspects: musculoskeletal, internal medical, digestive, emotional. And depending on where people have the greatest imbalance and what will give you the greatest effect is what I would recommend.
Yeah, I mean, I think one of the most traditional therapies that was always used alongside Master Herbalism is reflexology. And reflexology is a very simple but very, very powerful therapy. And it's become known a little bit as a kind of cosmetic process, but it's not. It's highly therapeutic if it's properly applied, and it can really work very well alongside herbal medicine. Likewise, kinesiology is very effective, and deep tissue, body work, and deep tissue massage or lymphatic drainage massage or any kind of Thai massage or rolfing.
I have found that body work, particularly reflexology, is very beneficial. It works side by side with the herbs and with the lifestyle changes. But referring to somebody like Caroline for psychotherapy or counselling it's something that I would do a lot in my practice, because with the iridology, it brings up a lot of issues that do need further therapies. So mindfulness is often recommended, yoga, all those other techniques that are out there and those other therapies. It's a whole body approach, isn't it? And it's an inclusive approach.
Yes. Do we ever refer to medical doctors?
Yes, I do, from time to time.
In what case would you, for example, would you refer a patient to a medical doctor?
There are some. I mean, there's all bodies end up in your consultation room, and there are people who naturally value alternative practice before orthodox, but there are some that just don't. I mean, orthodox is really, they may come to me because they've heard I'm good at X or Y, and they're not there because they really believe in what we do. So occasionally, if it is a case that I know there could be extreme adrenal exhaustion, that if that person might need a blood test or the nod from the doctor or the okay from the doctor, that they confirm what I am sending them to the doctor for. So if that increases their capacity to deal with what they have to deal with, if they need that affirming nod from a GP, or they need that scan to show that yes, they have fibroids in their ovaries, then yes, I absolutely do. I try and also you have a broken leg potentially, you have these mechanical issues that do need medical fixing.
I would refer to doctors when any of the red flags occur. For example, present rather in the clinics. For example, if somebody has the bleeding, rectal bleeding or any kind of blood in the stool, that's a red flag. Or if they have, severe headaches which have gone on for a long time and haven't been diagnosed, or they have markings in the iris which indicate there could be more serious problems in the head area, we would of course refer. But it's interesting because people usually come to us at the end of having been through the allopathic system. They rarely choose us as a first supportive call. They tend to come when they've been told that there's nothing else to be done and they'll be on steroids for a long time, or the skin condition won't clear up without X or Y medication which has side effects. So people often come with quite severe chronic conditions which have been long-standing and they've already been to the medics.
But you are going to get them at every single, you're going to catch them at the beginning of the process, in the middle of the process, and there's other people, or you're going to be at the end. So you have to be really versatile in how you present. And that's why, again, the long consultation is, again, the most valuable thing, because you'll know where to put the emphasis for some people.
I think it's really important that as you know, a group of practitioners or a body, that we're building bridges with other professions, and there's a very clear understanding that, like as you say, when the time is appropriate, we will of course refer to medical doctors, and vice versa, because often people feel like it's one or the other. That they can't come here because they've went there.
They shouldn't
or
have
they can't.
to choose.
And people don't have to choose. These things can work together. And moving forward, as Master Herbalism moves forward into the mainstream, we need to be able to have them relationships with different people.
There are some incredible vitalistic medical doctors out there, and there are some who are atomistic, and I suppose we have to take each individual on the merits of how they practice, but definitely it's about complementary rather than one or the other.
Okay, so the final question then is, what is the future of Master Herbalism and the plant-based lifestyle that Master Herbalists recommend?
There's an interesting development in medicine at the moment now with in relation to gut bacteria and stuff like that. And it's only happened since they've been able to genome sequence gut bacteria, but they're now realizing how important a healthy biome is. And one of the interesting things is that they've discovered that the plant-based diet promotes a very healthy gut bacteria. And that's just it's becoming more and more mainstream, and I think people are going to become more and more aware of that as a reason to be more plant-based as well.
I think because our approach is so vitalistic, and because it's so whole body, and because of the success that we have with our patients, it's becoming increasingly popular, and I think it can only continue to develop in that way.
I think as well, I agree with you, Jenny. I think patients are looking for somebody to really listen to them, and more than just listen to them, but come up with very practical and real solutions that they can actually implement into their lifestyle, not just to be given some kind of a remedy and everything will be okay afterwards.
I agree.
So I'd like to thank you all very much for coming. It's been a very interesting discussion. We plan to have more of these events in the future, and to go into more detail discussing conditions that we treat and approaches we might have to health conditions. And our series is called Master Herbalists Speak. So watch this space. Thank you very much.
Thank you.
Thank you.
Helen.